Why are these conditions missed or ignored? You can add mistrust, historical trauma. And I would say it's not just historical trauma, it's modern day trauma. A lot of African Americans don't feel heard in medical settings. They feel rushed or dismissed, or they've experienced bias, unequal treatment. And this can lead to delayed care, skip visits, or stopping medications. And that's one of the reasons why Health Facts, WVOE, PressureMDAcademy, our goal is to get you into American healthcare earlier when you got control. Because if you wait until you are sick, then you're at the mercy of whoever is there. But if you get it earlier, you can learn that they're different. So you start to learn that there are more than one, you have options. And so it's easier to understand that when you're well, so that if you go in for your checkup and things don't go right and you go to another one. But unfortunately for us, like I said, a lot of times we get the one bad experience, and who do we tell? We tell everybody about the bad experience. We don't tell anybody about the good experience. Then you also have real harm. There's documentation of the healthcare and healthcare providers actively doing harm. I mean, like I said, I think the most famous one is the Tuskegee experiment. And that implication of what happened there that reverberates throughout generations and is an easy thing for people to point to. Some of the distrust. On top of that, the reason why people have mistrust and historical trauma. One of the things is not feeling heard or feeling rushed. One of the things I always like to tell people is that there have been documentations that for a primary care clinician to function properly, they actually build in that clinician, that physician is only supposed to spend, I think it was like 8 minutes per patient. That's the way that system was designed. And that's one of the reasons why you come in there with 5 problems, they make you pick one, and then you got to come back. As I'm kind of going through my own practice, you start learning about the billing and find out that the insurance company won't pay for you to take care of 5 problems. They only pay you to take care of the one, and you have to bring the person back, which of course doesn't make any sense. But all this stuff leads to mistrust, especially if you knew somebody that had a bad experience or if you're not familiar with how this stuff works. Or the other thing is this, you had problems for 3 years and then you walk in there, you got like 10 problems and you want them all solved at one time, but nope, you got to come back 10 different times to get each one of those problems sorted out. It really exacerbates in a community where there's already mistrust, there's already perceived mistreatment and things of nature going on. It really adds to the problem because you don't go get the care or you skip the visits, you can't get the care that you need in order to get everything under control, okay? And then also you got the issue of medications being stopped. And why are they stopping the medication? You don't trust the doc, you don't trust the nurse, you don't trust who is going on there. Why? Because they did not have time to explain to you why you have this medication. Or you're trying to get something else taken care of. Maybe you came in because you stubbed your toe. They tell you got high blood pressure and to take these 3 medications. Like you get home, you're like, wait a minute, you ain't even fixed my toe. All that stuff contributes. So it's just the reality of what goes on there.